All right, I'm back again with this is day 3 of my updates of my microdiscectomy, laminectomy, however they pronounce it. Um, the uh, the way that these surgical procedures go, they make an incision in your back. They go down to the vertebrae, and they shave a little bit off of the bone so they can get down to the nerve root. Then they move the nerve root out of the way. The nerve root that's being affected, in my situation, it was the L5 and the S1 nerve root that were being affected. And what they do is they move the nerve out of the way and then pull out the herniated portion of the ruptured disc. And if there's any portion of the bulging disc that's in the way, they shave that off also. I'm not exactly sure what the doctor had to do for me. I know that he did say that when he went in there, he told my wife that the nerve was red, swollen and inflamed, of course. But as far as updates of pain, today has been the worst my pain has ever been. Starting late last night, when the procedure is done, before closing you up, they fill the area of the disc and the nerve with steroid. And they just squirt it down in there, and then they just pull everything out, and it just closes up around it. Seal you up with some like Dermabond, I think they call it, like super glue for tissue. And I didn't have any stitches. And so, but apparently what has happened is that that steroid is very temporary. Going in and doing the procedure, they use a hook that has a ball on the end, so it's not damaging the nerve, but they really do piss that nerve off. They go in and they move things around a lot, and they dig and they poke and they prod to get everything out, being sure to get all the bone spurs and things like that out of there. But that, of course, causes a lot of inflammation at the site of the surgery. So what's happened is that the steroid injection that they put in there has worn off, and so now I'm just feeling just raw, blunt pain. I was prescribed 80 Norco 5s. I've been eating those like candy. I've eaten approximately 20 of them already. Definitely take your laxatives. They will constipate you. So basically what's happened though is the swelling and inflammation in my back is putting pressure on the nerve, and the pain in my leg and my foot has returned. At times it's more intense than it was before I had the surgery done. As of recording this video right now, the pain in the bottom of my foot is pretty intense. It feels like I've cracked the bone in my heel. It hurts in my ankle. It hurts down the side of my foot. I have burning sensation going down the side of my leg. I have severe cramp feeling, or like tearing muscle type of feeling under my buttocks from the nerve pain. I had to go back to the doctor's office today because I was concerned with it. They told me that this is normal for this type of procedure. The swelling, the healing process, the steroid wearing off will lead to this type of pain, but it should subside soon. They prescribed me, like I said, the pain medication was, they gave me Norco 5s for pain. and they gave me promethazine. I think it's for nausea, but it also helps with spasms, muscle spasms. But last night, just trying to sleep, I had to sleep solely on my side. I could not roll over on my back at all. The pressure, just any kind of pressure, I felt like I was being torn open. Felt like my back was just being ripped open, and then anytime any pressure was put on the site of the cut, my leg would just light up with pain. Standing up would cause my leg to light up with pain. So, but sticking with the routine of trying to keep moving, taking my pain medication, just trying to move around as much as possible to keep myself from, kind of seizing up. The doctors want you to move as much as possible. So I'm just hoping that, right now that within the next couple of days, this inflammation in the back is going to go down, and the pain that I'm experiencing now will subside and start to clear up. But so far I have good hopes for this surgery, and just, if you're thinking about having this type of surgery done, from what I've seen on other YouTube videos, medical forums, people who've had it done say that it was the best thing that they've ever done. I'm seriously doubting that right now. It hurts real bad. So just so that you know what you're getting yourself into, you have to take that leap, make that decision to do this. For me, it was something I need to do. I have a 2.5-year-old little boy that wants daddy to pick him up all the time. I have a pretty active lifestyle. Love to walk, love to do woodworking and things like that. And when you have this type of injury in your back and you can't move, every little movement that you make is like a knife in your back, or jolts of electricity, bone crushing type of feelings. The nerves do some crazy things. So those of you who are dealing with this nerve pain in your legs, you know what I'm talking about. People will look at you like you're crazy, but it does cause all kind of crazy sensations. But yeah, today is March 22nd. Today was the day that I was originally supposed to have my surgery done, but I got lucky and had it pushed up early, and I had it done on Monday. So it is now almost midnight on March the 22nd. So about almost 3 full days into this. So I will give you guys an update tomorrow and let you know how I'm feeling from there, and hopefully it gets better from where I'm at now. All right, you guys take care.